Now we will read about pheochromocytoma. Just 1 or 2 lines are important from this topic for NAVLE. Other than that, it's not an important topic. Pheochromocytoma is an uncommon tumor in dogs and rare in cats. So it's basically rare, and it is a tumor of adrenal medulla, and we already discussed when we read about the adrenal cortex and medulla in Addison's disease that the adrenal medulla is responsible for secreting catecholamines, that is adrenaline and noradrenaline. So it's very obvious that in the tumor of adrenal medulla there will be excessive production of catecholamines. This is the only point that is important. Now the clinical signs are very non-specific and vague but are related to catecholamine release, like dyspnea, tachycardia, hypertension, occasional collapse, anorexia, weakness, and weight loss. That's it. For diagnosis, we use abdominal ultrasound or CT to detect adrenal mass. So the tumor is detected as a mass in ultrasonography. Indirectly, you can also measure the BP. So there will be hypertension. Catecholamines stimulate the sympathetic nervous system. Now for the treatment, surgical removal is the treatment of choice. That is what you need to remember. Some extra points are, it is risky because catecholamines make heart and BP unstable during anesthesia and during surgery, and tumor often tries to invade the big blood vessels nearby. So before surgery, give phenoxybenzamine for 1 to 2 days. Phenoxybenzamine is an alpha blocker, so it has sympatholytic effect. Now, if the surgery is not possible, the tumor is non-resectable, then there's a drug that you can give. It is a tyrosinase kinase inhibitor, TKI, it is named toceranib, and the trade name is Palladia. I will tell you the basic reason or the science behind this. Tyrosinase kinase, these are enzymes on the surface of the cell that act like on switch, like the switch on for cell growth, survival, blood vessel formations, and most of the tumors overexpress these receptors. So what happens is, when you give a tyrosinase kinase inhibitor drug, it will decrease the blood supply to the tumor, it will slow down the cell division. So basically it will turn off that switch that is responsible for cell growth and survival and blood vessels. Basically, toceranib or Palladia will starve the tumor. And the prognosis is good if the surgical removal is possible. If metastasis has occurred, poor prognosis. So all that you need to remember for pheochromocytoma is, it is a tumor of adrenal medulla. There is production of excessive catecholamines in this. The treatment is surgical removal. And in case they ask you about the drug, toceranib or Palladia, which is a tyrosinase kinase inhibitor. That is all. These 4 points are only important for NAVLE. Rest, nothing is important.